We'll be taking questions from those in the audience and from those who are coming in via web, and I think that Anna Maria will be asking those. So again, just as a reminder, please state your name and your affiliation. So we can open the session. I'll go ahead and ask the first question, and this is for Dr. Alongo, and it relates to one of the concepts that Dr. McCready's brought in relative to the issue of the use of omega-3 supplements, that it may be helpful for those people who start a little bit low, but may not be beneficial for those who are already have a reasonable intake. And similarly, in your studies, I noticed the New York study that it didn't have much of an effect, whereas the studies in the Gambia, there was a significant effect. So really, the bottom line question is, how important is the pre-pregnancy metabolic status relative to either protein or omega-3s relative to what the intake should be? And should we take this into consideration when we're kind of looking at what to recommend to people as they're getting ready to get pregnant or after the fact when they are pregnant?
Absolutely. I think that's a great point that you made. And in fact, as Dr. McCready was talking about it, I was reminded of the same thing as well. Because the pre-pregnancy nutritional status is absolutely important. And similar, coming back to, Leanne's point about, obese women, in fact, don't need to eat, even more calories. That's a great finding that you've found. Similar to that, I don't think, pregnant women who are already well-nourished, who start off in a fairly nourished state, need additional protein beyond their normal consumption patterns that they're currently having. So I would say it's almost similar to the omega-3 results that was being presented.
Okay. Other questions?
Can I ask a question about the protein? So I think this is really exciting advance, right? That the long-standing RDIs for protein now potentially should change based on your findings. And I'm wondering, if we were to change them, do you expect to see differences in birth outcomes?
I think, it comes back to the point which was raised earlier. In a well-nourished population, I don't think, we would actually see a significant change because I think it's a combination of, protein is one of the factors in the birth outcome, but, the other related, calories, healthcare, access to Medicare, various things then will have a role to play. And I think unless there is a major shift in their dietary pattern, once they become pregnant, which is what I'm more concerned about, I think, trying to switch to a new plant-based diet during pregnancy, as I was suggesting before, that's something that I'm really concerned about, because then you would be altering, your well-nourished state. Then you're changing an acute, protein quality, as well as the total protein amounts might be highly different during pregnancy. And this is not a time that you want to test these concepts.
Anna Maria?
Yes.
Questions from...
We have a question, and then I want to follow up with this question with Raj. So you're basically saying that it depends, I guess, on the shift of the woman's dietary pattern during pregnancy, in that, you might get somebody who is a modest individual who consumes red meat and some fish and other types of protein sources throughout the week, who all of a sudden decides to increase plant-based sources of foods. To that extent, that individual would be doing more with what we just heard Leanne being recommended, that in fact what you want to do is increase fiber intake, increase the quality of the carbohydrates. So I don't necessarily see that a shift all of a sudden during pregnancy would be potentially that harmful. At least we have no indications that that would be true.
I agree. I don't think there's any evidence to suggest that. I'm simply stating that as we, move forward with this climate change, sustainability issues, I'm just concerned. I'm not saying that there is any evidence to suggest that it is a problem, but I'm just setting the stage for the future that perhaps that should be in the back of our mind as we move forward.
So the question from one of our web participants says that, in line with the increased need of specific amino acids during pregnancy, are there specific foods that are good sources of those amino acids that should be recommended among vegan or vegetarian pregnant women?
Well, I don't think we are there yet to start giving recommendations based on an amino acid and then a food. However, in a variety of protein sources, whether they are from plant or animal sources, as long as there's variety, I think in a well-nourished mother to begin with, I think the consequences of those would be much more minimal of those individual amino acid demands. And I think even in my concluding statement, that's what I mentioned, that I think it's more of an issue in vulnerable women. Whereas in a well-nourished condition, I think the body has a buffering system which should adapt to that. If there is enough variety of plant sources, which is a mixture of legumes, pulses, and again dairy to a certain extent, because it is a easy source to meet many of those amino acids. As long as it's a variety of those plant sources, vegetarian sources, then it should be fine.
Question?
Erica Gunderson, Kaiser Permanente, Northern California. This is for Dr. Alongo. I wanted to get back to this pre-pregnancy metabolic body state and ask you about whether any of the protein requirement equations are calculated based on body composition, i.e. lean body mass versus overall body weight, which I noticed in one of your slides, you had 25% of your sample of 200 pregnant women were overweight, and we know BMI is a very crude indicator of body fat. So are any of the requirements linked to lean body mass size?
Maybe ask a clarification. So in the studies that we did, they were all healthy pregnant women.
Right.
Their pre-pregnancy reported were all under 25. So I'm not sure.
So maybe that was your requirement slide that showed some BMIs of 25 in the 75th percentile. But that was just an observation to see if body size made it, the requirements varied by body size. But what I'm really interested in is lean body mass variation and whether you've looked at the data in terms of that.
And I think that's a great question. And actually, I was going to quickly say that we actually have not looked at whether the protein demands are different in women with different body composition types. That has not been explored. It's something that we have discussed a lot in our labs, but we still haven't gotten around to doing that. We usually use that as an exclusion criteria, so all our inclusion criteria are for healthy pregnant women as well as healthy adults in the other stages of life as well.
And do you think that, and I think given the context of how that influences metabolic state, which is not measured preconceptually, I think that would be an exciting direction for your research.
Absolutely.
Thank you.
Next question.
Thank you, Dr. Longo, for a very nice talk. I'm Johanna Dwyer from Office of Dietary Supplements, NIH. I was wondering just two things. First of all, if you could give a little more explanation on the indicator amino acid method. And secondly, when you analyze the Rand, Young, Scrimshaw data, did you try using splines, and was the analysis different if you use splines?
Great questions. The Rand question is easy to answer because, in fact, when Dr. Rand redid all the analysis, it's in his publication as well. He does do those different quadratic equations as well as the biphase linear, which is our preferred choice. Those values are there in his papers as well. And there's a justification by them suggesting that they decided to not use those. And the reason being that any nitrogen balance which is on the right hand of the equation, which is very positive, is unbiological and it's not natural. So therefore they didn't include that. Whereas our argument was, when you do reanalyze it, because we are already artificially giving them low to a high anyways, we are trying to look for a response in in nitrogen balance. And we do know that nitrogen balance, actually, the efficiency reduces as requirement approaches near nitrogen balance. So taking all this into consideration, I think we should include the external values as well. And a biphase linear, simply because I think, when we think about it, yes, our equations in our body is all, quadratic. Everything there is it's not linear at all. But the reason why we do a biphase is because then you get a breakpoint, and that breakpoint determines your estimated average requirement. So whenever we do an experiment, we can only be confident about the mean. And the standard deviation is what it is. So I think in order to get that a breakpoint, we prefer to use a breakpoint analysis, which gives you a value. Then we can challenge that value. Our method, the indicator amino acid oxidation method, I did not go into the details of it, considering the time. But our method is using the same concept, which is going from an x-axis, from a very low to a high protein. We're looking for a different response parameter. Nitrogen balance is simply, a combination of retention versus excretion. Ours looks only at protein synthesis. That's our primary endpoint. But protein synthesis is what is regulated acutely. Breakdown takes much more longer period of time. So in our conceptual model, we feel that in our shortened acute model, the protein synthesis is a very good indicator of the body's demand.
Great, thank you. Anna Maria?
Another question from one of our audiences in the webinar, and this is for both of you. What about considering the amount of carbohydrate and protein needed for placenta metabolism with advancing gestation? Are we continuing to underestimate the requirements of macronutrients with the current DRIs, given what we know about placentas and their role?
Well, certainly for carbohydrates, as I pointed out, the requirements were derived from estimates of brain glucose utilization and haven't, as far as I know, stable isotope studies haven't been done at the whole body level, such as the model that is used by Dr. Alongo in pregnant women. So I would tend to think that they haven't been adjusted. It seems like they haven't because it's for the fetal brain. But your model certainly does because it's whole body.
Exactly. And I think, as Dr. Redmond and I were having a conversation before this, that's the advantage of using our method, because we actually introduce the isotope orally, and then we look for an endpoint from the mother, which actually includes the triad, which includes the placenta and the fetus. So our responses include all the mother as a whole, as a whole unit during pregnancy. However, do we know individually how the placenta versus the fetus, partitions that? From our data, you cannot interpret that.
So another question is related to plant-based milks. And so given the fact that you show data that most vegetarians are consuming their protein from dairy products, how does the shift towards plant-based milks potentially affect protein intakes and meeting their adequacy for DRIs?
Great question, I think, and that is kind of where I was alluding to with the respect to how our diet supply is changing. If anybody was to compare any of those alternative milk products to the milk, it's very obvious right away that the protein content is going to be significantly low. And I think even if they have a protein supplement added into that, I think the concern I would have is with the composition of that. I think it's very hard, similar to how it's almost impossible to mimic human milk. I think it's almost very hard to, achieve the status of bovine milk as well in any of those. And I think that's kind of where I would be focusing my attention on, an observation as we move forward, as people switch in their dietary pattern from a vegetarian to a vegan.
Next question.
Thank you both for your very thoughtful and complete presentations. I'm Barbara Laraya from UC Berkeley. This question is for Dr. Redmond. I appreciate that you pointed out this recommendation of 10% of calories that can be added sugar. It seems exceedingly high when you consider a 2,000 calorie diet. 10% would be 200 calories, which is 50 grams. And as you pointed out, 135 grams of carbohydrates are recommended. So I want to pick your brain and how should we, or how would you think about this recommendation and what we really should be recommending pregnant women for added sugars? How would you go about quantifying or approaching that?
Yeah, so I mean, added sugars also fall into the classification of the monosaccharide carbohydrates. So these are the refined sugars that are the ones that have the worst metabolic outcomes, not only for pregnant women, but for anyone. And so I do think that having a recommendation that's a little more stringent makes more sense. But I mean, we'll be looking to see what the 2020 dietary guidelines tell us about, the evidence synthesis around that. But I agree with you that it seems to be very, very liberal, especially when we see the current data of intake of added sugar. That was what I presented from NHANES, showing that, at least 1/3 or a little more than 1/3 is coming from sugar-sweetened beverages and fruit juices and those sorts of things. So it's highly prevalent for sure.
But no approach at hand, like how you would want to tease out the amount?
Yeah, I mean, it's highly complicated, as we all appreciate. There's many dietitians in the room to discern the dietary intake of individuals. And so teasing it out is based on intake is by a food record. I don't really know a way to tease it out in terms of a stable isotope or another kind of method. I mean, we know that added sugars shouldn't be there at all. So the value should be zero. I mean, really, yeah. But can I ask a question about the protein? So, Raj, you made the point that the current DRIs are static, and that the new data which you have collected in your lab clearly shows that protein requirements increase across pregnancy. I'm interested in your thoughts on whether or not you would make a recommendation that's trimester specific, or whether you would still pose a static requirement because it's a little more simple for people to comprehend. And so whether that would be something in the middle of the two, or whether you would propose the level that's later in pregnancy for the whole duration.
It's a great question, and I think we should probably look at the WHO for guidelines for that. The current WHO guidelines states additional protein demands in grams per day, and I think that's a much more better way to go, because then it tells people that if you were to gain X amount of gestational body weight, the current recommendations are about 25 to 30 grams of additional protein a day in late stages, whereas there's not any need to increase protein in the first trimester, and there's a modest increase in the second trimester, and then I think it's about 12 grams per day, and then it increases about 30 grams per day in late stages. And I think that's an easier recommendation from a translational point of view.
Okay, I think with that, we'll wrap up this session. Thank all of the speakers for their great presentations, and we'll reconvene at 10:35.